Cosmetic dentistry can be done with a number of materials, and the two that we tend to use, or the two kind of white or tooth coloured materials, is either what we call composite resin, and sometimes the term they use is bonding, or we use porcelain. And they're quite different. Composite resin basically is a resin material that is fairly soft, and also we use it directly in the patient's mouth. So usually what happens is the preparation is done on the patient's tooth, and then through layering techniques and things, the tooth is slowly built up with composite resin. Composite resin is a material that's actually quite soft. So over time, there's two issues that we will get with composite resin. One is it will wear faster, and secondly, we'll find that you may get some pitting or change in the colour of the tooth because it's slightly porous. On the other hand, porcelain veneers are actually created outside the mouth by a dental ceramist. So the ceramist really has a lot more time, because if we're doing it directly in the mouth, the issue is that we can't keep a patient there for 3, 4, 5, 6, 7 hours to try and do a cosmetic case. We can actually do the preparation and take moulds, and from those moulds make a model, and on that model fabricate the porcelain indirectly. So it's done in the lab. It probably takes around about 2 to 3 hours per porcelain veneer. There's more control that we have when we're doing it outside the mouth because we've got a lot more time, and also the material is much different. We're talking about a material that is very, very inert, very, very strong, and once we've actually completed the porcelain, we're able then to bond it in the patient's mouth. So we can do work in either composite, as in directly in the patient's mouth, or we can do it in porcelain, which is actually done outside by a ceramist. The main differences that we see with both of them is that we've got more control and can do more changes in porcelain, and it definitely lasts longer. The thing you have to though remember is because it's done externally by a ceramist, the costs are usually 2 to 3 times higher than if we did it in composite resin, but the results are much longer.